There's something special about being in the presence of someone that you trust, in a place that you trust. Trusted people in trusted places. Those are safe havens. I was fortunate to have many such places in my life as a child growing up, aside from my family home. The barbershop I would go to with my dad, where I would see tons of friendly faces and acquaintances. The Quaker Meeting House here at George School, where I would see many of my friends who were going through the same period of angst, discovery, and uncertainty that I was going through. And with my parents being pastors of a close-knit, mid-sized congregation, the church was always the most prominent of these safe places. The church holds special significance for many African Americans because it's a place in the community where we can get one-stop shopping for Maslow's full hierarchy of needs. Because of my parents' pastoral commitments, I'm confident, I have no doubts, that my brothers and I spent more time in church than any children in the history of the world. But the more time I spent there, the more I learned to enjoy it. And I finally succumbed to the very strong temptation to join in and participate. All of these places, the barbershop, meeting for worship, the church, they were places where I felt not only encouraged, but also compelled to let my voice be heard and to join in to the barbershop conversation or the meditation at meeting for worship or the call and response of the fiery sermon by the preacher or the fervent gospel song. What I loved most about being in those safe spaces was the affirmation that I got from those around me. Not only because we were sharing the same physical space, but because we were also sharing common values and experiences, and sometimes common struggles and challenges. Trusted people in trusted places. The countless hours that I spent in these safe places as a boy had a profound impact on me as a man, and especially as a physician. In addition to providing primary care at a public hospital, I also work on what are called place-based interventions to address health inequities. Basically, we develop solutions that are meant to be carried out in places outside of the traditional medical setting in order to improve health outcomes. We do this often in non-clinical settings, and it's carried out often by non-clinical people. Trusted people in trusted places. And I realize that part of what I do is I try to recreate some of my childhood safe havens, but actually recast them for healthcare delivery. And in particular, healthcare delivery to minority men. In the United States, black men are more likely than any other group to die from certain preventable causes of death, including high blood pressure and colon cancer. The inequities we see from these causes of death are often due to lack of timely screening, detection, and intervention. For colon cancer in particular, screening is extremely important for reducing mortality because in the screening process, we can actually detect precancerous growths that can be removed before cancer develops. Unfortunately, black men experience lower rates of colon cancer screening, sometimes because of lower engagement with primary care doctors, the doctors who actually make the referrals for cancer screening tests. So it's extremely important that we find a way to reach black men for screening so that we can reduce mortality from this preventable cause of death. But there are well-known barriers to black men accessing primary care, including lack of health insurance, Sometimes the perception that if there's nothing wrong with me right now, I don't need to go. And sometimes mistrust in the medical system, either due to historical or personally experienced mistreatment at the hands of medical providers. We found that we could actually address and overcome some of these barriers with place-based interventions in safe places such as black barbershops. In Dallas, Texas, we taught barbers how to measure blood pressure and how to use their influence to help their customers get the health care that they needed. We realized, after a successful randomized trial of this concept, that what we were doing was actually training barbers in the centuries-old tradition of the community health worker. Community health workers are men and women without a formal medical degree who are trained in a specific health-related task that helps to bridge communities to healthcare. When we observed that barbers could be very effective community health workers to help address the problem of high blood pressure in black men, we thought that other community leaders, such as pastors, could actually work in other trusted settings, such as churches, to address the problem of colon cancer in black men. The perfect illustration of this concept was Reverend Theodore Hickman, and we called him for short Ted. Ted was the pastor of a Presbyterian congregation in Brooklyn, New York. He was an incredibly kind and gentle man who had this presence and charisma that was very characteristic of the African American preaching tradition. Ted did not have any formal medical training, but he was a master communicator. And he had a way of reducing the size of the room, no matter how big it was, to just you and him. And he had a way of identifying men who had been resistant to colon cancer screening, figuring out what the barrier was, and not only convincing them of the need to be screened, but letting them know that he was going to be there with them every step of the way. Thanks to Ted, our men's health initiative in New York City reached over 20,000 New Yorkers with cancer prevention education and outreach. Ted personally navigated scores of black men for colon cancer screening. In a randomized trial, we found that the men who talked to Ted were twice as likely to go get screened compared to those who received a standard referral for screening. In another study, Ted showed that he, as a community health worker, could actually communicate knowledge about prostate cancer screening more effectively than physicians. And he was equally good at making them feel comfortable about their decision to screen. Ted was incredible. A trusted person in a trusted place. Ted passed away unexpectedly this summer. And I was surprised by my own reaction to his passing. I hadn't realized that Ted actually had become one of my closest friends. And without me knowing it, I had made Ted one of those trusted people in my life. And because of Ted, my workplace had actually become a safe and trusted place. So there's growing evidence of the effectiveness of community health worker-based interventions and place-based interventions. And Ted showed us why. It's because the people make the place. Community health workers like Ted make trusted places portable. Ted was able to make wherever he was that trusted place. So let's increase the ranks of the Teds of the world. Increase the number of trusted people who are able to make trusted places in order to improve health. And in doing so, we can move more towards our goal of achieving health equity. Thank you very much.